Okay, first thing I'm going to do for the ABG draw is go ahead and check the patient's chart before entering. I'm going to look at the patient's history, see any behavioral things, if they're on a one-to-one or anything like that. I'm also going to check the patient's history, their medications to see if they're on any blood thinners. If so, that will change things a little bit, like I'll have to hold down on that artery a little bit longer after the draw. So once I've reviewed my chart and made sure everything was okay, that gathered my information, I'll go ahead and gather my supplies. I'm going to get a towel and an ABG kit and enter the patient's room. Upon entering the patient's room, I'll introduce myself. Hi, my name's Kate. I'm with the respiratory team here at the hospital. Looks like Dr. So-and-so put in an order to get a arterial blood sample from you so we can check your oxygen levels in your blood. This is a little bit different than when the nurses drew blood from you earlier. I need to check your artery, or this is arterial blood, not venous blood. So I need to check your arteries in your wrist here and see if we can get a good sample. So when the patient says that's okay with them, I'll go ahead and wash my hands. I'll go ahead and wash my hands, put on gloves, and perform the Allen's test on the patient. With the Allen's test, I will hold the patient's wrist here and I'll ask them to go ahead and make a fist. Upon that, I will put pressure down on both the radial and ulnar artery. And then after a little bit, I'm going to go ahead and lift the ulnar artery and ask the patient to release. The patient's fingers will be white, and then it should peak up within 3 to 5 seconds to see if there's a good blood flow return there. And if so, that means we have good collateral return on the artery. So looks like, Mr. Skeleton, I got a perfect artery here to get a sample from. Your radial artery you're going to use in your wrist. So I'll go ahead and get my ABG kit. I'll grab my towel. I'm going to place the patient's wrist up on the towel. This is going to help that the artery doesn't roll away from me. And I'm going to go ahead and fill out the patient's label here. Name, date, the room number. I'll take the patient's temperature, go ahead and put that on there, and I'm going to go ahead and just stick that right on my biohazard bag. So now that I have everything set up, I have my gauze here, my bandage is prepped and ready to go. I have my alcohol wipe. I'll go ahead and palpate for that radial artery. I'm going to keep my finger on here and clean the area with the alcohol pad. I'm going to grab my syringe and take the cap off and pull back the syringe to 1.5 milliliters. We at least need 0.5 milliliters for a sample to do the blood gas. I'll make sure that the bevel is facing upward. I'm going to hold the needle like a pencil, and I'm going to go ahead and insert at a 45-degree angle. I'll make sure that to let the patient know, okay, Mr. Skeleton, we're going to go ahead and insert the needle on 1, 2, and 3. Inserting at a 45-degree angle. I have pressure here. I'm not taking my hands off of the patient. I have my gauze. I'm watching it fill up. Once I at least have 0.5 milliliters, I'm going to draw back the needle, keeping it away from me. I'll cork the needle, hold down on the artery for 3 to 5 minutes. I'm going to place bandage on here, and I will go ahead and get my sample, get the cap, place it on. I'll take the syringe or I'll take the sample and go ahead and put it in a sharps container, not the sample, the needle, I'll put it in the sharps container. I have my biohazard bag and I'll set it in here. Oh, and I also looked at the syringe to make sure there was no air bubbles or anything in it. Now that I have that all set and ready, okay, thank you, Mr. Skellington, for your time. We will, the doctor will let you know about the results of that test. Here's your call light. Make sure the patient is comfortable. Take off my gloves, wash my hands, take the sample with me, and send it off to lab.